Hello everyone. Hi. Welcome to this Friday's live physio Q&A. I'm Lucy Macdonald, physiotherapist, and I'm here to answer any of your questions about your pain, injury, training, and anything you'd like to ask. So I can see there's quite a few people that have joined us already. So if you'd like to, first of all, as usual, for those of you that have joined me before, welcome back. Please do let me know that you can see me and hear me loud and clear. My camera keeps falling off today, so hopefully it won't fall off halfway through our Q&A. Hello everyone, welcome. I can see there's lots of people joining, which is fabulous. Please do start typing away in the comments any questions that you have about your pain, injuries, training, any worries about motivation or anything like that. Please do just share. As I said at the beginning, my name is Lucy Macdonald. I'm a physiotherapist. I've been a physio for 20 years and I would love to share all my knowledge that I have with you, enable you to recover from any pain or injury that you might have and really enjoy your training. Excellent, Alan. As ever, it's fabulous to have you here. Glad you can hear me loud and clear. That is excellent. And Carla, nice to see you back as well. And Lucy, welcome as well. As ever, I love to hear where you're all tuning in from. Miguel, hi. I love to hear where you're all tuning in from. We've had some fabulously exotic places over the last months. Actually, it's been a year now since I've been doing these. In fact, I should find out when the live Q&A birthday is, shouldn't I? And we should have a little celebration. So yes, please do start asking me your questions that you have about anything, pain, injury, training, etc. And I will answer them. Hello in London. I'm in London too, if you haven't joined me before. And in the past, we've had people from Denmark, South Carolina, Australia, all sorts of fabulous places. So please let me know where you're all tuning in from. It's always quite fun to hear. So I haven't got any advanced questions today, although I know there was a few people that messaged me in advance to say that they were going to be joining. So I will answer your live questions first. So whoever gets in there first with their live questions, I will answer them. And I will continue until I have answered all your questions that you have. Actually, no, that's not true. If I have a day like I have, every now and then I have a absolute bumper of a day where hundreds of people seem to answer questions, and unfortunately I can't sit here and answer your questions all day, but if I give it a limit of an hour, so I will answer all your questions in the next hour. First of all, I'd like to point out my amazing mug, in case any of you are watching it and they're watching me drink it and wonder if it is what you think it is. It is indeed a beautiful octopus. Anyway, right, I'm going to crack on answering your questions now. So we have a question here. I have discomfort behind my knee. I've started with the Running Man exercise. How many times a week should I be doing physio exercises? Thank you. That's a pleasure. It's an awesome question, Lucy. And I think it's really, really important if you are seeing a physio or a sports therapist or osteopath, that you do ask them for specifics around the frequency and number of repetitions that you should be doing, because depending on the frequency and number of repetitions, you'll have different results. So you've asked me about the Running Man exercise. Now, the Running Man exercise is more of a movement patterning exercise. It also works depending on how you do it and what your specific weaknesses are. It will particularly work, and tell me, Lucy, if this is the case with you. It will particularly work the muscles on the outer part of the hip, so your gluteus medius muscle. It's that you can often feel it in the buttock there, on the outside of the buttock, which is great. Now, if you're trying to then get your pelvis in the right position, get your back in the right position, knees, feet, and you're trying to also lift your heel a little bit so that you're training your calf and really trying to improve the way that you're loading and landing when you're running or walking, then you really do need to be doing it every day. So that's because it's like learning any new skill. So the more frequently you do it, the quicker you'll learn that skill. And I would recommend that you do the running man exercise every day, and I would recommend 30 repetitions. Now, because I'm not seeing you, I'm not your physio, I do need to advise you that you absolutely must not do it if it's painful. And that goes for any of the exercises that you're doing. It's always important to make sure you get a diagnosis with a physiotherapist or a health professional to make sure that you are not doing any further damage and you're doing things that are actually going to help the problem. So the running man will help to do a number of things, which is why for those of you that have who are regulars to these Friday sessions, you will know it's up there with my absolute favourite exercise for runners. But having said that, if you're getting pain in the back of your knee, it's possibly not going to be the thing that's going to solve the problem. It might help, and it's kind of a good starting point as a bit of a DIY biomechanical assessment. When I'm looking at people doing, as most of you probably know, I do tons of virtual physio. So most of what I do and have done over the last year has been seeing people by video consultation, which has worked really well, much to the surprise of almost everyone who thinks, how on earth is virtual physio going to be effective? And then they're pleasantly surprised that it is. Anyway, so when I'm doing an assessment, I will always look at the way that you're moving, and doing things like getting you into that running man position will give me an indicator as to which bits are weak, which bits might be tight or stiff or a bit unstable, and therefore enable me to give you more targeted exercises to improve those different elements. So as I say, Running Man is an excellent exercise, but it's not going to be the be-all and end-all. There's a number of different things that could cause pain at the back of the knee. There's a lot of things that can refer pain to the back of the knee. There's lots and lots of structures of the knee. Where's my knee? Well, not my knee. This knee. So this is a plastic model of the knee, for those of you that might be squeamish and might wonder if this is a real one. It's not, it's plastic. So you can see, if we look at the back of the knee, that very, very basically you've got, you can see these blue things are your meniscus, and then it's easier to open it up this way, but you can see that this surface of the bone it has cartilage on top of it, and then you've got loads of muscles and nerves and blood vessels and various different structures. You've got a synovium that runs around and encapsulates the fluid inside your knee joint. So there's lots of things that could be causing it. If it's more to the outside and you can kind of run your fingers down the tendons, down the outer aspect of the knee, then it could be your hamstring tendons, if you can actually ping them and feel it, or give them a squeeze and feel it, and in which case a loading program would be the right thing for you. But I won't start second guessing all the different things that it could be. I hope that's helpful, Lucy. Let me know if there's anything based on what I've said that you'd like to ask. Okie doke. Big swig of Octopus coffee. And welcome to everyone who continues to join us. Please do keep tapping away with your questions, and I will keep answering them. So next question. I've started to increase my running. Let me just switch to this one while I'm reading the question, and then I'll switch back again. Hi there. I've started to increase my running and find that my lower back has started to hurt a bit. Any tips, please? Yes, certainly, Scott. I have lots of tips. So first of all, as with all injuries, and this isn't just back soreness, which is obviously one of the most common forms of pain, it's often worth looking at your program and considering how quickly you've built up your running, or if you've been doing a different type of exercise, or if you're getting pain sitting at your desk, how quickly have you increased the amount of time doing that particular activity that is now painful. And it's probable that you have increased your running too quickly. And you just need to perhaps take a step back, not stop running, but just come back to the previous level, and then build up a little bit more slowly in smaller increments. Now, that's because the body, and as you develop fitness, the body is designed to go through this absolutely fabulous process of microtrauma, regeneration, repair. And what happens is when you slightly damage your tissues, the body responds by creating bigger, stronger, more resilient tissue. And that happens in slightly different ways in different parts of the body, but it will only happen if you give it enough time to recover, and if you put in all the components of recovery, which is why every Friday I talk a lot about recovery. So in terms of getting your nutrition right, making sure that you're sleeping well and you're managing your stress levels, because all those things will enable you to recover. But as I say, coming back to the first point, if you're just creating too much of an increase in load too quickly, you're going to create too much of that microtrauma, which will end up with more sustained levels of pain. So that would be my first thing, to just have a look at your overall training program. My second one, again, goes with any kind of sort of gradual niggly pain that comes on with exercise. It's probable that you need to have a look at whether you're doing strength and conditioning. I'm not sure, Scott, maybe you can share with me if you're doing any strength and conditioning at the moment. But it's really important for runners to be doing a couple of sessions a week. Now, it doesn't have to be a really intensive weight session in the gym where you're having to spend hours on end lifting all sorts of crazy things. Literally a 15-20 minute little training session twice a week, spread out, not back to back. Spread out, so with 3 days at least in between each one, where you're working your muscles to fatigue and you're really helping to strengthen your muscles, will help. Now, with back pain, a lot of people think, obviously, because it's your back, people often think, let me just get Bob, again, plastic model. People often think because it's your back, you should focus on training your back muscles, your abdominal muscles, your what's commonly known as core muscles. And that's right. But your back will also be taking more load if the other muscles of your legs in particular are weak. So it's really worth making sure that you're training your glutes muscles, so both the gluteus maximus muscles at the back of the buttocks, your gluteus medius with the wall ball exercise, which if you go onto the website you'll find it on there. And also your quads muscles, your calf muscles being the major muscle groups with running. So if you've got a weakness in those muscles and you've got an inefficiency in the way that you're running, then you might find that you're getting a bit more wobbling occurring in your lower back, excuse me, and therefore more stresses and strains in your back. Now, with back problems, it sounds to me like, Scott, you have a very specific reason for your back pain. For those of you who might be watching who have back pain and are wondering, oh, does this apply to me? It's really, really important with back pain to note that it's not the severity of the pain that's an indicator of long-term damage. What it is other factors, for example, reduction in sensation in the inner parts of your thighs, weakness in your legs. And I have made a little video. So I know that there's probably people watching along with Scott who might have back pain, and I've made a little video just so that you guys can watch this, and gives me a chance to have a cup of tea. Well, not a cup of tea, I'm not going to go for that long, have a swig of my coffee while you're watching this wee graphic. So let me play it, and then I will be right back. I think it's about 24 seconds, so here it is. What extraordinarily cheesy that was. I was watching the numbers of viewers and I was thinking, I hope I don't lose all of you to that. Anyway, I hope the content of it was helpful. Maybe I'll choose a different track next time. Scott, I hope that's been helpful with answering your question about your back. As you can tell, I haven't launched into the million different structures that could be causing your pain. But as I say, irrespective of the structure, I hope that's been helpful advice. But I obviously, as I do with everyone, I would recommend that you get it checked out. I'd be happy to do so, either me or my team, by video consultation, and keep me posted on how you're getting on. Right, next question. Hello, Carla. Nice to see you again. I will read this out. Okay, so tuning in from Strood. Very nice. Actually, do you know what? I thought that was Stroud. I'm not sure I know where Strood is, but I'm going to look it up after this. But Kent, we often have people from Kent. It's fabulous. Welcome from Kent. My new runners are struggling a little with their breathing. In fact, Carla, I just realised it's probably because you suggest your runners join us. That's probably why we have so many people from Kent. So welcome, everyone. My new runners are struggling a little with their breathing, also with their mindset. A lot of them start with, I can't do this, even though they smash every session. What's your advice? Oh, I love this topic. So I'm absolutely fascinated, and I'm constantly reading about human motivation. So how we will motivate ourselves, in part for myself and in part for my patients. So when people, and this is a classic, Carla, if you're starting to make positive lifestyle changes, so as you know, I've already talked about recovery, and the components of recovery are in part the stress management, the nutrition management, the sleep. Those things are really, really fundamental, as well as exercise. So exercise is like the magic pill that we all should be taking in order to prolong our lives and prolong the quality of our lives. So I think it's really fabulous, Carla, that you guide people into running, because it's just such a accessible, awesome thing to be doing from a health perspective. Now, here's the thing, and I've been reflecting on this lots recently and discussing it with colleagues, is that you have to make it become part of your identity. Now, probably for you, Carla, a bit like me, exercising is part of who I am. Like I associate with being a sort of healthy person, a fit person. I don't think I'm a sporty person as such, but I certainly, for many years, have really and continue to work hard on making positive lifestyle choices. In part because I'm a physio, and I literally spend every single day sharing that knowledge and those skills with other people. So I think it would be a little bit hypocritical if I didn't try and at least do my very best to follow as much of that advice as possible. So the thing is that when you're starting something new, or you're wanting to make a change in your life, so if you're, let's say, for example, you're wanting to do a marathon for the first time, and you don't consider yourself a runner. And I'm sure some of the runners who are watching this will appreciate this, is that if you go back, if you can remember before you started running, that you didn't identify with being a runner. Okay, so you'd go out for your run, you'd come back, and then at some point in your life, someone would say, oh, I'm not a runner like you. And you suddenly think, am I a runner? Oh, maybe I am a runner. So when the running starts to become part of who you are and who you identify with, so part of your identity, then the chances of you running regularly go for forever and ever, or for a very long time anyway, massively increase, because it becomes so fundamental to who you are. So we're very, very motivated by our emotions, our rational mind. So we know that we should be doing X, Y, and Z for A, B, and C reason. But unless we really connect with it on an emotional level, it just doesn't work. So what I would suggest that you do, Carla, is that you ask people why they're running. So obviously the purpose of why they're running. Now, something like I want to be fit, or I want to lose weight, or I want to whatever, probably isn't going to cut the mustard. What it needs to be is something really fundamental to their values. So, for example, if, say, someone's values are their family, and I don't know, their family. Let's start with that. So say one of their really key driving factors is their family, right? So why is it that running is so important? What's the relationship between running or making that positive lifestyle change with family? Okay, so I'll give you a personal example. So I like to do it because it keeps my mental health in check. Now, that alone, again, isn't enough for me, which it should be, obviously, but it isn't enough. The reason that that my mental health is so important is so that I can be a good mother to my children and not be a grumpy old cow most of the time. So if I go running regularly or if I do exercise regularly, then I am fulfilling that particular value, that particular purpose in my life. So it kind of really runs deep. So I would suggest, as I say, that all of you, if anyone's struggling with motivation and with your runners at the moment, is to really dig deep, get them to sort of write down what their values are. And there's a few different, I love Brené Brown. She does values in a pretty straightforward way, so she gets you to whittle them down to just two, and then associate why they've chosen to run and why they have signed up with you with those values, and see if then they can slowly but surely identify as a runner. So there you go. There's a million other things, and I did a blog recently. So please do, if you go onto the website and you stick in motivation at the top, you'll see I talk through loads of different ways of motivating, loads of different ways of building positive habits. And I think you might find that really interesting, Carla. I'd love to hear your feedback. I'd love to hear your comments, perhaps next week or in one of the Friday Q&As in future. So, okay, great. Hope the rest of you have found that useful. And if you have any tips for Carla's runners, then that would be really helpful. I know last week we talked about the breathing element. So we talked about the importance of training breathing when you're not running, in order that then it's a lot easier when you do run. So when you're breathing, if you can, or when you're breathing, when you're not running, if you can try and focus on breathing through your nose and actually do breathing techniques like the ones on the website. So if you stick the word breathing or even breathing exercises into the search tool on www.octopusclinic.com, then there'll be some exercises that come up. One of them is a YouTube video that I did about this time last year for people with COVID. The same things apply. So practicing sitting up, breathing through your nose, thinking about expanding your lower lungs, because that's where the best gas exchange takes place. But there's also some other exercises lying on your side where it helps to expand the lower lungs. But if you can practice doing it before running, you've got more chance doing it when you are running. Because if you just suddenly in the middle of a run, when you're already out of breath, start trying to do breathing techniques, it ain't going to happen. So yeah, perhaps before you take them for a run, Carla, you could go through some breathing exercises together. Although you may well do that already. Okay, so next question. Next question is all about knees. So let's have a look at this question. So for those of you who have joined more recently and are wondering who I am, my name's Lucy Macdonald. I'm a physiotherapist. I have been a physio for 20 years. And if you'd like to ask any questions about your pain, injuries, training, I would be very happy to answer them. And also let me know where you're tuning in from, because I quite like hearing that too. So the next question is, I have a meniscus injury. It's been almost 6 months and I still haven't recovered. Is this amount of time normal? It's common for sure, Miguel, but I think it sounds like, I'm not sure if you're having any physiotherapy or any other kind of rehab, sports rehab or anything. But I think it would be really useful to know to what degree your meniscus was damaged. And when you say you still haven't recovered, to what extent have you not recovered? So is it that you're sort of 90% better, but you're not quite back to running? Or is it that you're still really struggling with day-to-day things like going up and down stairs or sitting in a chair for long periods of time? So it'd be good to know, where you're at in terms of your ability with your knees. So for those of you who are wondering what on earth a meniscus is, I did mention it right at the beginning, didn't I? But this is, so I'll do this in front of you, otherwise you'll wonder what it is. So this is the knee joint. If we take off the kneecap and open up the knee, your menisci are not blue, but they are in this model. So you can see these two moon-shaped cartilages that sit on the bottom of the knee joints on your tibia, and they're really helpful for shock absorbency, and also they help congruency of the joint, so they keep the ballish shape sit in the socket-ish shape better. And as you flex your knee, the meniscus drops off the back of the knee, so that's where the meniscus tends to be vulnerable. So Miguel, that's where I would start. Actually, I would say, how much deep flexion are you doing at the moment? And I'd possibly temporarily bring it back a bit. If you're doing loads and loads of deep flexion, then perhaps your meniscus hasn't had a chance to recover. So it might be that you don't stop doing things like squats, deadlifts, etc., but that you just don't do it with such a deep range of motion, and that you modify things so that you're strengthening your quads, your hamstrings, your calf muscles, and all the rest of it. But those three particular muscle groups as they pass over the knee, but just not taking them through the range of motion that really kind of puts the meniscus under strain. The other thing is that with meniscal injuries, you often get secondary kneecap issues, because when you have a meniscus injury, you get swelling inside the knee, as I'm sure you know too well. And what then happens is that reduces the ability for the muscles that insert into the kneecap. It reduces their ability to contract properly. And then you can end up with problems with being able to load the kneecap. So say, for example, and this is a huge sweeping statement, but for example, if you find it more difficult walking downstairs rather than upstairs, it's possible that rather than your meniscus still giving you jip, it's actually your kneecap that's giving you the pain that you're experiencing. So I'd want to do a thorough assessment on you, ask you lots and lots of questions to find out, as I say, exactly what movements are sore, what positions are sore, whereabouts it's sore, and the history of your pain, because that will again give us a really good indication as to what the treatment plan is going to be like, and what muscles we need to strengthen, stretch, etc. Because at this stage, I wouldn't be thinking it's particularly common for a meniscus issue to be an acute meniscus injury to be still an issue at 6 months, depending on the degree of that issue. So do get in touch. You can see there, oh whoops, I didn't actually swap it to you. But anyway, you've seen throughout this how to get in touch with us, Miguel. I would strongly recommend that you get in touch, and we can do a video consult and sort you out with the right exercises that will enable your knee to recover fully. Next question. The next. Okay, yeah, that's great, Lucy. I look forward to hearing from you. Okay, next question. So, hi, Brian. Welcome. I will answer your question next. But just a few bits and bobs from other people that have been answering. So, Scott, when you say you've been starting to do them, figuring out what to do is the challenge. I can't remember what that was in relation to. Strength and conditioning. Okay, that's a really good point, actually, because I forgot to mention, I've done a video on the best exercises for runners. So the two videos that I always recommend that people runners watch, are the recovery video and the the best exercises for runners. So again, if you go onto the website, www.octopusclinic.com, and you put in recovery the word recovery, that video will come up, and also the video, if you put in best exercises runners, ta-ta, and in that I talk through both the movement patterning things like wall ball, but also strength-based stuff. Like my favourite strength and conditioning exercises for runners, runners is the split squat with a weight and a twist. But there are lots of others on there. So yes, hopefully that one is helpful for you, Scott, and many other people watching too. So Brian, I will answer your question now. If anyone else wants to ask any questions, please do tap away. I am going to, if I don't hear from anyone else, I will start to wrap up after I've answered Brian's question. So, well, I'll answer the first one anyway, and you can guess the second part, Brian. So here the question is, thank you for your videos. That's a pleasure. How do you feel about ice baths? And also, where am I from? Well, first of all, you can guess the second part, and I'll let you know if it's right. I did actually say right at the beginning of this video. So, okay. So, how do I feel about ice baths? So, how do I feel about them and what do I think about them from a professional perspective are two different things. What do I feel about them? I think that I wouldn't enjoy them, and I would probably run a mile from anyone that suggested that I get in one. No, that's not true. If there was enough evidence to convince me that ice baths were the way forward, then I would do it. If I was somewhere like a very hot country doing an ultra marathon and there was the option for an ice bath at the end of the day, then I would probably do that. But most of the time, I don't think that I would bother with an ice bath. There's much better ways of recovering from doing a really intensive training session or a competition. So basically, when you do, as I say, either a competition like a marathon or something that you've not done before, you put more strain through your body, or you've just done a really, really intensive training session and you put more strain through your body than it's used to. The absolute best things that you can do are try to keep moving, try to get enough sleep, eat properly, manage your stress levels. And if you do all of those things right, then those are the things that are going to enable your recovery. Things like icing, wearing compression garments, etc. There is some evidence and some clinical reasoning behind why they might work, but there is absolutely no conclusive evidence as to whether they work or not. Okay, so when, as a physiotherapist, I'm always looking at evidence-based practice. So I'm always doing things that are really grounded in science, and then sometimes we use techniques that haven't had huge randomized trials applied to them, but that they are grounded, as I say, in solid clinical reasoning. With these, it's a bit hit and miss. So some studies show that getting in an ice bath, people really enjoy it. I always hesitate to say that because I find it extraordinary. But anyway, I think people swear by them. So people will say, they'll probably be runners watching this saying, oh no, well, I would never, what's she talking about? I get in an ice bath every time I've done a marathon. And if that's the case for you and that works for you, then I'm not suggesting that you don't, because I don't think they do any harm. But equally, if your mate's telling you, well, it works for me, it's going to work for you, that's just not the case. The science doesn't back that up. So let them get on their merry way and hop in an ice bath. But if it doesn't float your boat, then don't go for it yourself. It's actually, interestingly, the same around applying ice post-injury. We don't actually have a huge amount of evidence that tells us that is a good thing to do. So it's just something that we've done forever. So we've just advised people to do that sort of thing for a very long time. And so sort of changing that culture and it's just some people, as I say, find it very helpful, and ice can be useful to reduce pain. So again, but it will only be useful to reduce pain if it's not something that absolutely horrifies you. So some people are not, particularly bothered about getting into cold water. Some people think it's vile. If you're the former and you are in sort of generalized pain, then it might help. But certainly be careful. Any kind of it's called. Be careful not to burn yourself. Not nice. I've unfortunately seen people. It tends to be calf muscles that I've seen ice burns on, where people stick a ice pack underneath their calf muscle and stick it up on the sofa, watch the telly, and then forget about it, and then take the ice pack off, and they've got these great big hideous blisters all over their calf. So if you are going to use an ice pack, just make sure that you wrap it up properly, and then you only use it for 5-10 minutes on and then off, and keep checking your skin. So hopefully, Brian, I did enjoy that question. So thanks for asking that question. I hope I answered it, although it was probably not the black and white answer that you were hoping for. Unfortunately, our medical world has this totally unrealistic. Everyone has this unrealistic expectation that there's it's a sort of black and white world, in that we have a very, very clear indication of this is exactly what you should do, exactly when you should do it, and it's just not the case. That's why the response, it depends. I could answer every single one of your fabulous questions today and on every other Friday with "it depends," and then leave it at that. But hopefully the information that I've shared with you all today has been helpful. I know there's still quite a lot of you watching, and I know sometimes there can be a little bit of a delay in the time that you tap your questions, the time that it comes up. So I'm just going to give it one more minute. I might put on one of my little graphics. My throat's a bit dry, so finish my coffee, put on one of my graphics, and then this one's on Achilles tendinopathy, which I think you've seen before, and I quite like it because I quite like the music that's in it. So here it goes. Right, hope you like that. Right, so I'm going to wrap up now. For those of you still watching, please do invite your friends, family. The more the merrier. I do love to hear all your questions and to answer them. I hope that you found all the information that I've shared with you today helpful, and I wish you all a question come in. No, I'm so pleased that you found it helpful, Carla. Thank you. Check out the website and use the handy search tool at the top there. You can put in anything, so if you want to put in breathing, or you want to put in best exercises runners, or Achilles tendinopathy, there's tons and tons of information. I used to write all the information, and now I try to make videos, but I love hearing suggestions from you on what videos to do. So let me know if you have suggestions. That'd be awesome. Anything that would be helpful. So hopefully see you again next time, Carla, and also Alan and my fabulous regulars, as well as those of you who have joined for the first time. Thank you very much, and have a lovely weekend. Bye.